Okay, let's refine some of the functional neutral, some of the bracing techniques that we've done for core stability work. I've mentioned in a couple posts before regarding low back pain, how to engage. The differences between how to engage different muscles in your core. Okay, there's different strategies that we have that we don't use anymore. The first one being the abdominal hollowing technique, which I've mentioned in a previous post, where, and just have you go and do it, just go and pull your belly in. Okay, a lot of people initially we're trying to engage the transversus abdominis muscle, which is right over here, by drawing their navel in. We call that hollowing. Okay, and we found though that by bracing, and that by trying to engage several different muscles around the core, we get better stability, better core stability. And we've in my last video, we've talked about that bracing technique. So go ahead and just brace for me. We just did. Okay. So when you go to brace, these muscles actually come out. They actually become more rounded through here. Instead of hollowing through here, they become more rounded. Okay. Now, when this initial research came out, it really talked about it talked about two different muscles: the transversus abdominis muscle, as well as the diaphragm. And the diaphragm's been kind of like lost in the shuffle. We've kind of gotten away from emphasizing a diaphragmatic contraction. Okay, so going forward, what we want to do is we want to really make you more aware of how to breathe properly and how to engage your diaphragm in combination with the transversus to, in a sense, create stability from the inside out instead of from the outside in. Okay, we want to do both, but you don't want to forget about that diaphragm because it's just so pivotal when it comes to that next, I guess the missing link in some people that don't get better. Okay, maybe that's the reason they're not engaging from the inside out. Okay, so let's talk about proper breathing first. So hand on the chest and then hand on the belly. Okay, and I'll instruct my patients. I want you to just take a deep breath for me. Go ahead and breathe in just like you would normally. Okay, in a lot of circumstances, what happens is the hand up top moves. Okay, that's upper respiratory breathing. That's not what we want. We want more abdominal breathing. Okay, so go ahead and take a deep breath. And what I want you to do is just take and place a little bit of pressure against your belly. Okay, when you breathe in, try to push that pressure out against your hand. Okay, I want that belly to come up as she breathes in. Okay, when that happens, the diaphragm's actually moving down, creating a different change of pressure in the thoracic cage area, drawing air into the lungs. Okay, so when you see that belly coming up, the diaphragm's being engaged. Okay, what we want to see. Put your hand back down there. When she goes to take a deep breath, no movement up here. We should see the belly coming out, and we should see the rib cage going out, moving out laterally. Okay, so it's more of a lower rib cage expansion versus an upper rib cage elevation. Okay, so and then relax. Okay, and then breathe in again. When you breathe, I want to feel that rib cage flaring out this way, and the belly coming up, and then relax. Okay. So once they master the proper breathing techniques, what you want to do is you want to have them breathe in again. Okay, belly comes up. Okay, maintain this, ribs expand here. Now, I want you to maintain that tension. We call it the bracing. Maintain the bracing effect here, and then breathe back out. But keep that tension in the abdomen. Okay, and when people have a hard time with this, what we tend to do is, what I want you to do is I want you to push out when you breathe in from kind of like you're trying to push your abdomen out against my fingers down through here, okay? And then push, breathe in, push against my fingers, maintain that, and then breathe out. Maintain the tension, and breathe out. Good. And then breathe in again. And when you breathe in, you're thinking about pushing out against my fingers. Okay? So what we're trying to do is we're trying to engage several different muscles. We're engaging the transversus abdominis, and then we're engaging the diaphragm at the same time. Okay, and this, of course, is assuming that they're already in their neutral position down through here, which we've already talked about previously. Making sure that they've got a little bit of inward curve at their lumbar spine. When they engage the core, when they engage the diaphragm, they shouldn't lose that neutral. Okay, and then from that, our first step is to really just challenge somebody to, first off, perform this just in this position here, and then to hold it, roll onto their side, sit back up, to work on the same techniques in sitting, and then to stand and work on the same techniques in standing, and then to work on the same techniques with squatting. And this is stuff that we'll talk about when you come to see some therapy. But the basics are what I talked about as far as how to engage these and kind of refining, and like I said, what we've done before in our previous posts on our core stability exercises. Okay, that's it. Thanks.